Hey, welcome to Medical Licentiate Emerson Educational Channel. Medical professionals and students needs to know about Ludwig's angina. You see, Ludwig's angina is a serious infection, and it can escalate quickly. We're talking about a potentially life-threatening situation if it's not caught and treated early on. Think of it like this. Your head and neck are prime real estate, and this infection wants to take over. That's why we're going to break down everything you need to know, from how it starts to how we fight back. Let's get to it. So, what exactly is Ludwig's angina? In simple terms, it's a bacterial infection that sets up shop in the floor of your mouth and neck. It usually starts with something small like a tooth infection or a recent dental procedure. Bacteria, those tiny troublemakers, find their way into the tissues under the tongue and start multiplying like crazy. As they grow, they create pus and inflammation, and that's when things start to get serious. This infection is a bit like a fire. If you catch it early, you can contain it. But if it's left unchecked, it can spread rapidly, affecting vital structures in the neck, like the airways. Now let's talk about how to spot Ludwig's angina in your patients. Remember, early recognition is key. One of the first things you might notice is swelling and redness under the tongue and jaw. Patients often complain of pain, especially when swallowing or even speaking. As the infection progresses, the swelling can become so severe that it starts to close off the airway, making it difficult to breathe. Other telltale signs include fever, chills, drooling, and a muffled voice, almost like they're talking with a mouthful of marbles. If you see these red flags, it's time to act fast. Diagnosing Ludwig's angina is like solving a medical mystery. You'll need to gather clues from the patient's history, physical exam, and some key tests. Start by asking about recent dental work, infections, or any other medical conditions. During the physical exam, pay close attention to the head and neck, looking for swelling, redness, and tenderness. To confirm your suspicions, you'll likely order imaging tests like a CT scan or MRI. These scans provide a detailed look at the infected area, helping you assess the extent of the infection and guide treatment decisions. Section 5. Fighting back. Treatment strategies for Ludwig's angina. When it comes to treating Ludwig's angina, time is of the essence. This rapidly progressing infection can lead to life-threatening complications if not addressed promptly. The condition primarily affects the floor of the mouth, under the tongue, and can cause severe swelling that obstructs the airway. The primary goals are to secure the airway, fight the infection, and prevent complications. Immediate medical intervention is crucial to ensure the patient can breathe properly and to halt the spread of the infection. Airway management is crucial, especially if the swelling is severe. The swelling can quickly block the airway, making it difficult or impossible for the patient to breathe. Medical professionals must act swiftly to assess the extent of the swelling and determine the best course of action. This might involve inserting a breathing tube or even performing a tracheostomy to create an alternate airway. Intubation is often the first line of defense, but in more severe cases, a tracheostomy may be necessary to bypass the obstructed airway and ensure adequate oxygenation. Next up, we need to tackle the infection head-on with intravenous antibiotics. These medications are administered directly into the bloodstream to ensure rapid and effective treatment. The choice of antibiotics is critical and is often based on the suspected bacteria causing the infection. These powerful medications help to kill the bacteria and stop the infection from spreading further. The treatment regimen may include a combination of antibiotics to cover a broad spectrum of potential bacterial pathogens. In some cases, surgery might be necessary to drain the infected area and remove any dead tissue. This procedure helps to reduce the pressure caused by the swelling and allows the antibiotics to reach the infected tissues more effectively. This helps to reduce pressure and promote healing. Post-surgery care is essential to monitor the patient's recovery and to ensure that the infection does not recur. Regular follow-ups and continued antibiotic therapy may be required to achieve full recovery. Section 6. Staying ahead of the curve, complications and long-term outlook. While most patients with Ludwig's angina recover fully with prompt treatment, it's important to be aware of potential complications. One of the most serious complications is airway obstruction, which can be life-threatening if not addressed immediately. Other potential complications include sepsis, a life-threatening immune response to infection, and mediastinitis, an infection that spreads to the chest cavity. The good news is that with early diagnosis and aggressive treatment, the prognosis for Ludwig's angina is generally good. Section 7. Knowledge is power, the importance of early recognition. So why is it so important for medical students and practitioners to be well-versed in Ludwig's angina? Because early recognition and intervention can be the difference between a positive outcome and a potentially life-threatening situation. By understanding the pathophysiology, clinical features, and management strategies, you'll be better equipped to identify and treat this serious condition, ensuring the best possible outcomes for your patients. Remember, knowledge is power. Section 8 Case Study. When a toothache became a medical emergency. Let me tell you about a patient I saw a few years back, a young man in his early 20s who came to the ER complaining of a severe toothache. He was visibly distressed, clutching his jaw and wincing with every movement. The pain had started as a dull ache but had escalated to an unbearable throbbing that radiated through his entire face. He'd been having pain for a few days, but it had gotten progressively worse. He mentioned that over-the-counter painkillers were no longer effective, and he was unable to sleep or eat properly. His face was swollen and he had a fever, which indicated a possible infection. When I examined him, I noticed significant swelling under his tongue and jaw, and he had difficulty speaking. The swelling was so severe that it was pushing his tongue upwards, making it hard for him to breathe comfortably. His lower jaw was tender to the touch, and there was a noticeable redness spreading across his neck. His voice was muffled, and he was drooling slightly. He could barely open his mouth, and his speech was slurred. It was clear that the infection was spreading rapidly, and immediate intervention was necessary to prevent further complications. Based on his symptoms and the rapid progression of his condition, I suspected Ludwig's angina. This is a serious, potentially life-threatening cellulitis of the floor of the mouth, usually occurring after a dental infection. It can lead to airway obstruction if not treated promptly. We immediately started him on intravenous antibiotics and secured his airway. This involved a team of specialists, including an ENT surgeon and an anesthesiologist, to ensure that his breathing was not compromised. The antibiotics were crucial in controlling the infection, and we monitored him closely for any signs of deterioration. Thankfully, he responded well to treatment and made a full recovery. After a few days in the hospital, the swelling subsided, and he was able to speak and eat normally again. He was discharged with a course of oral antibiotics and instructions to follow up with his dentist to address the underlying dental issue. This case highlights the importance of a high index of suspicion for Ludwig's angina, especially in patients presenting with dental pain and swelling in the head and neck region. Early diagnosis and prompt treatment are critical to prevent serious complications. It also underscores the need for good dental hygiene and regular checkups to avoid such severe infections. Always seek medical attention if you experience persistent or worsening dental pain. Section 9. Final thoughts. Ludwig's angina, a reminder of interconnected health. Ludwig's angina might seem like a niche condition, often overshadowed by more common dental issues or other medical emergencies. However, it serves as a powerful reminder of the interconnectedness of human health. The human body is a complex network where one issue can influence another, sometimes in unexpected ways. What starts as a seemingly minor dental issue, such as an untreated tooth infection, can quickly escalate into a life-threatening situation if left unchecked. Ludwig's angina is a prime example of this, where an infection in the mouth can spread to the neck and beyond, causing severe complications. As future healthcare providers, it's our responsibility to stay informed about conditions like Ludwig's angina. Continuous education and awareness are crucial in the medical field. By understanding the pathways through which infections can spread, we can better anticipate and prevent severe outcomes. This knowledge enables us to provide the best possible care to our patients. Remember, early recognition and prompt treatment are vital. The sooner we identify the signs of Ludwig's angina, the quicker we can intervene and potentially save lives. A comprehensive understanding of the disease process is key to achieving positive outcomes. This means not only knowing the symptoms but also understanding the underlying causes and the best treatment protocols. Keep learning, keep asking questions, and stay curious about the latest medical research and advancements. Never underestimate the power of a thorough medical evaluation. Taking the time to conduct a detailed patient history and examination can reveal critical information that might otherwise be missed. This diligence can make all the difference in patient outcomes. Until next time, stay healthy and stay curious. Continue to expand your knowledge and skills, and always strive to provide the best care possible. Your dedication and commitment to learning are what make a difference in the lives of your patients. and thank you for watching Medical Licentiate Emerson channel. Subscribe and turn on the notification for more.